Arizona, of course, is no stranger to wildfires, and it's not just the flames, of course, that are dangerous. That haze can change our air quality. It can cause a lot of health problems, especially for anyone who has asthma, other respiratory issues. So what do we need to know? What can you do to stay healthy? Joining us this morning is medical researcher Dr. Ernst von Schwarz. Thanks for being with us this morning. So let us know first, I look at these air quality monitors across the valley, and they're not really registering an uptick because it's not at the surface, but it's hard not to worry when you see all of that out there and wonder, am I breathing this in and is it affecting me?
Oh, good morning, April. You're absolutely right. I just went out to my car. I don't know if you can see my fingers. I mean, that's black. The surface of the car is covered in ashes. So imagine that stuff is in the air and we do breathe that in. So it's not only the risk being exposed closely to fires with all the burns, but the air quality, as you mentioned, exposes us at much higher risk to worsen underlying heart conditions. So in the hospital emergency rooms, we see so many more people with heart attacks, with strokes, with worsening heart failure, even with clots in their system, because those tiny particles in the air, they can travel through the lungs into the blood system and causes a lot of damage for the heart, the lungs, and all our blood vessels.
Wow. So I imagine those ER visits are up for people who have asthma and other respiratory illnesses. What about the rest of us? For someone who's otherwise healthy, is it unsafe to be outside? I mean, obviously it probably is when we're seeing scenes like this in San Francisco, but what about even here in the valley when we can see just that general haze?
Absolutely. I mean, I'm in LA, and even here, the recommendation from our side is now avoid outdoor activities or eliminate outdoor activities as much as possible, especially don't exercise with that bad air quality. Stay inside and keep in mind the number one protection is to use a lot of moisture in the air. So basically use air humidifiers in your bedrooms. Some people recommend to don't put your clothes in the dryer after you wash them, but hang them in your bedrooms. Put bowls of water next to the windows. Use air cleaners. And like I said, avoid heavy exercise, especially outside. Just stay inside at this point.
Absolutely. Yeah, adding moisture to the air is critical to helping. Let me ask you this. Are the masks that we're wearing, does that do anything, or are most of the masks we're wearing not really the type of grade that would help?
Good question, April. The N95 respirator masks actually protect us somewhat against smoke inhalation, but they are limited, and as you know, they are usually meant for us, for the physicians and the nurses in the hospitals. But if you have them, by all means, use them. The usual face cloth doesn't really prevent smoke inhalation and that air quality right now.
Okay, my last question for you, are there long-term impacts to our health from, these prolonged fire seasons now where it's becoming more normal now that we're seeing these episodes of smoke?
Yes, there are, especially in the elderly and in children and in those with underlying heart and lung diseases. Yeah, that can affect negatively the vascular structure, can cause, like I said earlier, clots in the vascular system, which can have long-term effects. And another thing is, of course, all the stress with that can cause, we see a lot of cases of what we call the broken heart syndrome right now, which could be fatal in some cases. People can die of that.
Well, thank you so much for joining us this morning. It's important that we're armed with this information as this smoke doesn't look to go away anytime soon. Stay safe there in California. Thank you.
Thank you, April.